Hello viewers, I'm Zahur Islam and you are watching me on my YouTube channel. Uh, Today the topic of my lecture is treatment protocol or treatment plan B for mild to moderate dehydration. For examples, whenever there is mild to moderate dehydration, mean when the different electrolytes they are lost from your body during diarrhea, during loose motion. So, what will be the treatment strategy or treatment protocols? So, per child with mild to moderate dehydration, so use the treatment plan B. So, what is plan B? So, child to be treated in the healthy facility. For example, so give ORS oral rehydration solution over the first 4 hours as shown in the table 2.3. So I'm going to show the table 2 to 3 that is already given at the end of this page. So give ORS oral rehydration solution over the first 4 hours. If the child vomits, then wait for 10 minutes and start again. Continue with other fluid the child will accept. So instruct the mother to continue the breastfeeding if child is breastfed. Observe the stools passed and record the quantity. Check for the signs of worsening dehydrations. Now, after that, if the eyes become puffy, or if I mean that if the eye become swell up, so too much fluid is being given, so stop the ORS oral rehydration solution and continue with breast milk or water or other fluid if child is not breastfed. Reassess the state of dehydration after 4 hours. So, as we have discussed, that initially you will have to give an ORS in the first 4 hours, as it is shown in the table. For example, if the child vomits, then you can wait for 10 minutes and then start again. Then continue with other fluid. The child will accept. So after that, you can also instruct the mother to continue the breastfeeding if child is breastfeed. So if clinical state has improved with no dehydration, then go to plan A. So plan A will be discussed inshallah in my upcoming lectures. If there is still mild moderate dehydration, repeat plan B. If the condition is worsening, then go to plan C. Now what is treatment by fluid therapy? This is plan B. So if the weight is less than 6 kg, then the age is up to 4 months. So the amount of ORS is 200 to 400 ml. This is clear. If the weight of the baby is 6 to or greater than 10 kg, mean 4 months up to 12 months, then the amount of ORS will be 400 to 700 ml. Look at the age, look at the weight of the baby. So according to the weight of the baby, so we will increase the quantity or the amount of the fluid which is needed by the that particular patients. So here the age is 4 months and here the age is 4 months up to 12 months. So if the weight is 10 to or greater than, mean if it is the boundary line between 10 to 12 kg, or it's the age of the candidate is 12 months or up to 2 years, so the amount of ORS is 700 and 700 to 900 ml is needed to meet this requirement. So if the weight is 12 to 19 kg, then the age of the candidate is 2 years up to 5 years. Then he or she needs 900 to 1400 ml or oral rehydration solution. Use the child age only when you do not know the weight. The approximate amount of ORS required in ml can also be calculated by multiplying the child weight in kg by 75.